Dr. Meehan began her career working with patients with opioid use disorders at Bellevue Hospital's methadone treatment program, and later with Partnership for Strong Communities, addressing house inequities and homelessness in Connecticut. These experiences led her to pursue medicine focused on underserved communities. She completed medical school at Jefferson Medical College and residency, plus chief residency at UCSF San Francisco General Hospital. She joined the University of Arizona Department of Family and Community Medicine at Banner University Medical Center, Tucson in 2014, and completed an integrative medicine fellowship through the Andrew Will Center for Integrative Medicine in 2016. She currently serves as Associate Director for National Integrative Medicine and Residency Program and Associate Program Director for the UA Family Medicine Residency. She practices full spectrum family medicine and is passionate about caring for underserved populations and improving resident education. Dr. Meehan, when you're ready, you can go ahead and start sharing your screen.
Thank you. Hi, everyone. Do you guys work with Emma Goodstein in OB care? Yeah? Okay. She's one of my very good friends and was one of my residents, so you'll have to tell her that I say hi when you all see her next. Okay. Well, it is a pleasure. Can you all see my screen? The thumbs up was really helpful. Yeah? Okay. It's really a pleasure to speak with you. I was telling Mario and Jennifer basically how I got connected to even speak to your organization today, but it was through a prior coordinator that saw me at Society for Teachers for Family Medicine at a conference in LA a couple years ago. And then last year, I gave a similar talk to this at the same conference, but in Utah. And she asked if I would be willing to talk to this organization and all the different residency programs that are a part of it. And I was really excited to do so. So today's talk is going to be a little bit of a mix of introducing this tool, which I'm not sure if any of you have because it doesn't look like you have it, but we will make it available to you to be able to kind of work through it. If you do have some scratch paper or even the notes section of your phone a little bit later, I'm going to ask you to do a reflective process and then we'll kind of talk about what that was like for you. But I want to talk about the development of this tool and then how we're using it in our program. And you can think about if it might be something that you think would be helpful for you personally or to bring back to your larger programs. So to introduce myself and kind of what I do, I am a full spectrum family medicine doctor. I do OB care, vaginal births. I am not C-section trained, but I do vaginal births. I do newborn nursery. I do adult inpatient medicine and then outpatient clinic. And I work at a mobile health program for prenatal care for women. And then we do their deliveries at Banner for women who don't have insurance. And so I take care of babies all the way up to the end of people's lives and find a lot of meaning in the full spectrum. I love residency education and have been previously a program director and now I'm an associate program director and really think that figuring out how to address our well-being in medicine and allows us to have a more sustainable career. And I think it's something that should not be overlooked. And so this is just a tool for self-reflection on how you're doing that we are now using with our residents, and I will explain more. So the goals and objectives of today is to explore a model for creating basically and like a community around a well-being action plan within a residency program. And we're going to discuss what successes we had with this model and what barriers we overcame for implementation. And then I'm going to have you all experiment with it yourselves. So the background, as I mentioned, I used to be a program director. We had two smaller programs, which is where Dr. Goodstein was part of my program, the smaller program. And we then merged into a larger program. And we additionally, I was program director during the time of COVID, and our program, as well as I know New Mexico in general as a state, like the Southwest in the US, got hit very, very hard. And I think our patient populations are actually pretty similar. And it was a lot for our residents and a lot for our faculty. And we got pulled into places in the hospital and saw death at a higher rate than before. And I think that that experience in particular, and then thinking about how best to take care of residents in their training and help prepare them for a career afterwards, got me thinking about this concept of the gardener and the carpenter. At the same time that COVID was happening, I was having my third child, and I heard this podcast, or this, I guess, segment on NPR that was featuring this author, Alison Gopnik, and her new book at the time, The Gardener and the Carpenter. And I was really taken by it, both as a mother and as a residency program director at the time. And the concept really was that you can give somebody all the tools and like show them the manual and teach them exactly what to do and then set them out. But if then whatever happens in their future doesn't follow that exact manual, or you're not telling them what to do next step, you aren't necessarily teaching them how to be ready for what the world might bring them. And so her book is on parenting, and I don't mean to make this sound patronizing at all about residents, but I think it's actually very similar to all of us as humans. If somebody teaches you a new skill and they tell you exactly what to do, but they don't prepare you for the larger environment, you won't necessarily succeed every single time if something doesn't follow the exact suit. And so the concept of the gardener is, how do we create a garden that is nourishing and teaches you how to deal with different elements as they come in and out, so that you grow strong roots and there's diversity amongst the garden and you're better prepared for the future. And so I started thinking about that as a residency director, of like, how do I create a space in residency for training that is psychologically safe, that is spiritually nourishing, that is really thinking about the whole person as you're going through residency, because residency comes often at a time in people's lives where they're sandwiched between, the sandwich generation hits when you're in residency, right? Like, you're maybe having new relationships, you're having babies, you're starting to care for elderly parents or family members that need extra support, all while trying to do one of the most intense things in your life. And so I started thinking about that more, and realized as I was thinking about it more, as I worked on the garden actually worked on me and changed me. And I started realizing, what are the aspects of this that I need to take into my own practice as a physician and as a mother and as somebody that wants to integrate my entire life. Excuse me, I got to figure out how to go forward. So this slide is up here for me to just say, like, this whole idea of good vibes only is complete BS. And the reality is that we need the pressures and the hard stuff and the hardships, the difficult patient cases, the learning moments where we mess up and are supported to actually grow. And we should really be thinking about residency more as a metamorphosis rather than just a pushing of like everything's positive, and the toxic positivity can be really detrimental to our growth. And it's important for us to realize that sometimes that growth is messy and we become that goop in the cocoon before we emerge as the butterfly. Um, and residency. So residency is difficult. Like, it's not that like the rest of life gets put on hold when you're training in residency. And sometimes it's this really peaceful stream that just kind of trickles through, and other times it's a complete deluge. And we have to recognize that there's going to be both of those seasons while we're in training, and frankly beyond in our career. And this picture of all the stacks of rocks is a reminder to me that each individual trainee brings their own unique story. Like, everyone is facing something different in residency. And so essentially what happened, the pre-development, is one of my passions. When I was a chief resident, I got assigned to work with a couple residents that were considered like learners in difficulty or struggling learners, people who had reasons that they were having a harder time in their training than maybe the average. And not only did I learn so much as a teacher, but I also learned how much I really enjoy working with residents that maybe are not following the most straight and narrow path. And so I started realizing, like, I was putting a lot of energy into these types of learners, and there was not a one size fits all. And so what I also realized is often there's more complexity to why somebody may be struggling in their medical training, and it may be because there's more going on in their life, or there's more going on in the way that they process or learn. And like, our one size fits all medical training system often doesn't meet everybody's needs as well. And so essentially, I kind of started collecting all these residents that I was really passionate about working with, and realized, like, okay, what's going on? And at the same time, I got really involved with integrative medicine in residency, which is a national organization. I don't think that your program has that, but it's a 100-hour online curriculum that kind of talks about the intro to integrative medicine. And a lot of times there's like a well-being assessment as part of that program. And we had a different assessment that we did as part of our residency onboarding and orientation. And we asked people like, what keeps you healthy? What keeps you well? And I think those are really important questions. But we started realizing that, if you really add up all the things we're supposed to do to be healthy and well, it's actually in itself overwhelming, right? It's like, eat this, don't eat that, more vegetables, more protein, weightlifting, go to your doctor's appointments, and make sure you sleep 8 hours a night. And really, it's kind of a joke in residency to put people in this pressure cooker of an environment and then say, this screen represents like all the things that we often recommend. And it's just too much. And then breathe. And so I started thinking about how do we have a more productive conversation around this? Because especially we were doing this onboarding around the idea of well-being in orientation, and people had different flexibility often in medical school that they then had in residency. Residency becomes a training zone where you're being told where to be and when, and every couple months or weeks you're changing and you're in a totally new environment, and even that alone is a lot to take care of. And so as I was thinking about how ridiculous it was that I've created all these things that I'm supposed to be doing for myself, let alone like talking to these residents and saying, oh, you're in the deep end drowning. Now add in a meditation practice and do this. Like I felt like it was disingenuous and not helpful at all, and actually was leading to more stress. And I had this patient, this asthma patient, pediatric patient with their parent. And as I was filling out the asthma action plan, I was like, I wonder if we can make something kind of like this, but for well-being. And I created a well-being action plan. And so I want to credit the fact that I used the idea from the asthma action plan of we have things, I think sometimes depending on people's health literacy, it can be very confusing what your maintenance treatments are for asthma versus once you're having a triggered flare, what you treat for them when they're like in, starting to head towards crisis versus when they're literally in a medical emergency, what do they need? And similarly, when we are thinking about our own well-being, there's things that all of us probably can identify as the things that we do to keep us well, and that we need to do on a regular basis to know that we're doing okay. And then there's things like when we start to feel like we're really starting to unravel a little bit that we maybe need to do in a bigger, more focused way versus like when there's a true emergency, who do we call? And so, with help from my amazing program coordinator, her name is Stephanie Gearhart. She is very artistic. I kind of gave her the words and my idea, and then she helped me put it into this handout, which Mario, you can tell me who would have had this for them, maybe for them to get a copy of this.
Yes, it was sent to their program coordinator to print.
Okay. So you can ask your program coordinator. None of you guys have it, correct? It doesn't look like you do. No? Okay. So there is a copy of this that your program coordinator has. It would be awesome if you guys
do have it.
You do have it. Okay, great. Amazing. Well, if you could pull it out to look at it while I'm talking to you, that'd be very helpful for me. So just to orient you to this tool, the reason we call it a stoplight is we kind of came up with this idea again off of the asthma action plan of like a green zone, a yellow zone, and a red zone to health. And the green zone is when you're thriving. Like, what do you need to thrive? The yellow zone is when you're starting to feel kind of crunchy, which you don't have to raise your hand. I'm not going to call you out, but I regularly, I'm like, oh, I'm feeling a little irritable, or like I'm not responding with the same amount of patience to my children or to my learners or to even myself. Like I'm feeling more frustrated. That's kind of the yellow zone. The red zone is that you're starting to have like some burnout thoughts, or even worse, like we have had residents that have had much more serious needs, and that would be more the red zone. And so we designed the front half. So this is both sides of the sheet. We designed the front half to have you really think about what do you feel like when you're in the green zone? Like when you're feeling like, yeah, everything's flowing. Like I'm doing great professionally, personally, things are just, I'm jazzed. How do you feel? What does that feel like inside your body, inside your mind, maybe in your spiritual practice? How do you act? What do you do for how do you act towards others? How do you act towards yourself? How do you show up in your most important relationships? And how do you respond? I kind of talked to you a little bit about how I feel when I'm a little crunchy or crusty. But I think it's really personal, and I think it's important to reflect on this because for one person, they may realize that they like to go dancing when they're feeling like they want more connection, and other people are like, the idea of going dancing is the exact opposite of what I want to do. I like to get a book and read and talk to my partner about how much I like reading this book. And so people have different things that kind of keep them well, or they realize like, when I am feeling really overwhelmed, I do something strange. I like stress clean and I start like reorganizing things. And so my husband is like, "Oh, you're reorganizing the pantry. Like, how are you doing? What's going on?" But that's not what it looks like for everyone, right? So I think just taking a moment, and we'll take a break in a second for you to think about this. Um, in our hour, it's a little bit short. We often will give 30 minutes to our residents to go out and fill this out. But I want to ask you all to maybe pick one of the categories. You don't have to pick green, yellow, and red, but maybe pick whichever category feels most helpful for you to like think about, and think about how you feel, act, and respond in that zone. And there's some prompts on the right that like are just triggering questions to if you need a little bit more deeper dive. And the yellow zone, I like to think of as two things. One is what can I do to get back to the green zone? And what can I do in the yellow zone to not fall into the red zone? Red zone for me is like you are calling someone saying, I need a break, I need a leave of absence, I need to call a medical professional or a mental health professional. I need to connect with like something really serious, like my sleep's out of whack and I need to rearrange my work schedule so that I can get caught up on sleep, or I'm so far behind in my inbox, I'm going to need extra administrative time in order to get out of it. And on the backside is what are these things that we do in these zones? So you'll notice like kind of word prompts on the backside, behaviors that keep us well, preventative activities, therapies that you know that keep you well, whether that's medical, mental health, or physical therapies, small pivots to kind of keep you in the green zone. And then when you're in the yellow, this is when you're really starting to target activities like you know you must do X, Y, or Z. You are starting to renegotiate commitments. Are there things that like you don't actually have to do or that you can ask for more support while you're completing them? And then what do you do to prevent escalation? And then in the red, it's really how do I ensure my well-being? And who do I reach out for help? So to give you some examples, like we've had residents who've had medical diagnoses, either chronic medical conditions like type 1 diabetes, or we've had new cancer diagnoses during residency. We've had new autoimmune diseases being diagnosed, or people that have an autoimmune disease with flares during residency. We've had mental health people who come in with mental health diagnoses like bipolar or major depression, anxiety disorder, that have noticed that it's gotten worse at different times and have needed extra support. We've had residents go through divorce. We've had residents lose a loved one. We've had residents have children that all of a sudden, now that they have a baby, like things look very different for them. And so these are the types of things that we have talked with residents about and had them kind of think about their well-being action plan. So I'm going to take maybe 5 minutes. I'm going to take until the top of the hour. How about that? Till 12, and just let you think for yourself and whatever feels comfortable. You are not going to have to share this with anyone or with me. This is really for yourself. I may ask you to share like a reflection on how it felt for you if you want to. But this is nothing you write down will be shared with anyone or will be turned in. But I want you to take a moment and see if when you fill this out, you can do some reflection. And I'm going to be quiet. Are you all able to unmute your room so that people could speak up if they're interested? Is that a thing?
Okay, we're unmuted.
Amazing. Thank you. Um, Thank you for taking a little time. So my hope is that you can take these home and spend a little bit more time with them for yourself And the other thing that I will note is it's quite helpful to talk to the people that are really close to you, whether that is a partner or a best friend, or maybe depending on your relationships with your co-residents, somebody that you interact with regularly in residency, um, children, parents, whoever kind of knows you really well. Because I found I filled it out for myself, and I've revisited this many times, but I found that actually talking to some of those people, there are some insights from other people's perceptions of me, both positive and maybe places that you had blind spots. So sometimes they're like, "Wow, you're way more resilient, or you're so much better at committing to this piece of care for yourself than you gave yourself credit for." Or they may say like, "Yeah, I do notice like when you're not doing great, you tend to withdraw from, our friend group or whatever." And so it could be helpful just to kind of review it with somebody that you trust and love. We have actually had residents take this to their therapists, and their therapists are like, "This is awesome. Can we keep visiting this?" And so it's something that they actually use with their medical professionals that they're meeting with. So that was pretty rewarding to me to hear like a couple of residents come back and like, "My therapist thinks this is awesome." I'm like, "Awesome, this is great." So, um, I'm curious to hear from any of you in the room, like, have you ever filled out a well-being assessment before? If so, was this different than previous ones you've done or similar? Yeah.
I don't think anyone here has done it, it sounds like.
Okay. So this is new. Was the experience positive or uncomfortable or difficult? Like how would you describe the process of having to put some of this down into words or think about it even?
Well, I feel like it's a process that we probably need a lot more time to think about each of them individually.
Yes, I think this is
Resistance.
a really long
Yeah,
She said she felt resistance to think about it.
Yeah, I think that's real. I think, especially we are so good at taking care of other people, but the fact of like slowing down enough to be like, "Oh gosh, do I really have to think about this?" It's not always what we want to be doing. I think I feel that. That is not unique. And you should not feel any shame around having your first thought be like, "You've got to be kidding me that this lady via Zoom in Arizona is asking me to do this." And I would lean into that a little bit and see if over the next couple days, or you can even tuck it away for a while. And if you have a little bit of space, maybe on a different rotation, is it something that you might be interested or willing to revisit a little bit? Um, so let me tell you guys a little bit about our process and kind of how we've used it. So we did exactly what I'm doing with you today, although I was in person, and we provided a patient the paper handout. And then we talked about it, introduced it briefly, and then let the residents be. And we actually did this with our faculty as well. So again, this is not residents needed and nobody else does. This is all humans could benefit, I think. And it's really a self-guided reflective process. And we wanted people to be able to really think about what are the signs and symptoms of how they're doing from a well-being perspective. And I think that often we kind of miss the crusty, crispy period and we get to red. We go from green to red. Well, we actually experience yellow, but we don't recognize yellow. And so when we're starting to recognize things, if we can figure out what does it look like to be in the yellow zone, and that whole idea of like how do we not go into red and how do we get back up to green is really the like money spot. So we have created this. Now it's a part of our required curriculum here. We complete it every single year with every resident. We introduce it to the interns during their orientation, and then we have our second and third years have didactic time together that's sometimes separate from the interns. And so we do it with them during one of those sessions. Um, And then it's really for them to use at their discretion. We never bring it up with them again. That once a year they relook at it, but we don't have any accountability of people checking in with it. They don't have to meet with their advisors and specifically talk about it. Some of them choose optionally to include it as part of their individualized learning plan. That's what the ILP stands for. There have been some residents that have self-selected. Faculty, advisors, or program director have felt like having this shared language is really important. It's not mandatory that they share it. It's mandatory that they complete it, and then have a conversation around it. And those people are typically people that needed extra support for one reason or another. So we studied it. We actually had residents fill out a survey, and we've continued to have them fill out the survey. And actually, this action plan has gone to a number of other residency programs, and they've filled out the survey as well. And what we found is that it builds self-awareness and self-efficacy. So the difference between those two, one is being aware of how you act or what you might need. Self-efficacy is like the ability to enact a plan to get what you need on your own, which is really important, right? Like it's awesome. I'm assuming you all have advisors, mentors within your program, and it's kind of a nice built-in piece of residency training. But when you go out to practice, you might be a solo practitioner. You might be kind of working more on your own. So how do we help you have the skills and the tools to do this on your own when you're not in training? It promotes professionalism and creates accountability. They've done a ton of studies of how you make people more professional. And there's really like not a lot of things that can make people more professional. They've had all these conversations. You do all these online trainings and workshops and everything like that. But the only thing that has consistently in lots of research around professionalism helped elevate professionalism both individually and as a cohort is self-reflection. The more that people build their self-reflection skills and muscle, the more professional organizations are, and the higher level that those teams are able to operate on. It allows for a shared understanding of needs and personal well-being shorthand, which I'm going to talk about in a little bit because we had one resident that used this often. So we had a resident who was hospitalized for a mental health crisis. This was many years ago, and they did not realize that they were where they were. And it was really serious. And out of this, we started working with this person and created this action plan informal, or that person was the reason I made this formal because I was kind of doing this informally. And that person realized sleep was probably the most important thing for their mental health, and they were living alone, and so their sleep would get off and nobody would know about it, and they were just pushing through. And so this is going to sound maybe kind of strange, but getting a roommate was one of their major action plan interventions, because then if they had a trusted roommate that they could say, hey, if you notice that I'm starting to like stay up really late or have irregular sleep hours or do these sort of behaviors, I need you to gently and lovingly tell me, I'm worried that you're not doing okay. And that person got a roommate. That person was honest and open with their roommate about some of these things. And that person did so much better afterwards. And so that was a huge part of their action plan, was having some accountability with people. Their loved ones did not live in the same state. And so telephone can sometimes hide a lot of things that are going on. They needed somebody in their personal space. Additionally, that person, we actually made modifications to their residency training so that they didn't do certain night shift rotations going into certain day shifts so that their sleep wasn't getting dysregulated as much. And that was some extra help that was supported with our Disability Resource Center around making sure that their schedule could look different than others. And it was done confidentially, but it was done in order to maintain their mental health. And this person just did incredibly. Like, they are a phenomenal doctor, and they just needed a slightly different support system than they had when they first came in. And this whole idea of personal well-being shorthand was this person's word. They were like, it was so helpful to have this shared understanding of what I needed when I was in the red zone versus the yellow zone. And I could say, hey, I'm in the red zone. I'm calling my people. This is what I need from you. And that was it. Like, they didn't have to, when they were in the red zone, to then have to explain, I'm in the red zone. This is what's happening for me. I'm not doing well. I'm going to need this change. I'm going to need that. was a lot, especially when you're struggling. And so to have the shorthand of like, hey, I'm kind of like in the yellow, I think I need to talk to somebody about how I don't drop into red, became a really helpful way that we could use this tool. Some of this other things, it enhanced social networking. So again, like there were residents that were like, I know that I need to exercise 3 times a week and I am lonely. I don't have anyone to do this kind of exercise with me. And then all of a sudden when the residency started talking about it, it was like, wait, I like to do that too. I like to do that. I salsa dance. Like, can we meet up together? And so we actually noticed that our residents were making more connections about what kept them well when we were doing these workshops and then kind of talking about them. And then it also, I think for culture, from a culture perspective, it really like made the residents and faculty realize that we care about people's well-being and their health, and we want a shared mental model of how we keep each other well and support one another in this community. And then the last piece I think is actually really important for residency. It right-sized expectations. So if you notice on the back side where it says what, when, how often, with whom, when we initially were doing like well-being surveys or ideas for residents when they first came in, it's like, yeah, I'm a marathon runner. I want to keep running 50 miles a week. And it's like some very special residents can do that. But for the most part, you come into residency, if you know running is what keeps you kind of physically and mentally well, you might have to realize that 50 miles a week is no longer going to be realistic, but maybe you start picking out 5Ks that you do around town. But it kind of helps you realize like what can I do every day, like little spot doses, what are weekly interventions, what are monthly interventions, and what are yearly things that I do to keep myself well. But it had a more realistic expectation about what we're doing. So a lot of our, you can see similar to you all, 72% of our residents had never completed a well-being assessment prior to residency. About 80% felt that it was useful. Upon implementation, we had really a positive, overwhelmingly positive testimonials and feedback from people. And our advisors, when residents chose to share this, again, it's not mandatory that they share it, but when they chose to share it with their advisors felt like they had a more connected relationship and that they were more, the advisors reported a more higher score of satisfaction, feeling like they were better advisors to the residents, irrespective of the residents' beliefs, but they just felt that they were more useful when they had access to some of this information. And we just had like a lot of success stories. So the testimonial, I'll read it just because I don't know how small it is for you guys, but I'm going to just kind of keep it a little bit more brief than this. But the resident that I spoke to you about said, I believe there are many barriers that keep residents from reaching out and getting the help that they need in a timely manner. I'll feel that I don't want to be a burden on anyone else. I don't want to be seen as weak. Often my own pride will simply keep me from reaching out. And sometimes I just simply don't want to explain everything that's going on or be vulnerable. The red, yellow, green formula can help with the initial barrier of simply reaching out because of the simplicity. Rather than sending a text or making a phone call and feeling the need to explain every little thing and exactly how you're feeling, simply saying, I'm in the red right now, to someone who knows what that means for you personally can be in itself cathartic and enough to take future actions to help get you in a better place. I think something very strong about what we did was we had a meeting and went over everything that it meant for me to be in each category. We also talked about the things that would move me up versus move me down. For example, reading, golf, hiking would move me up, while often 24-hour shifts, inpatient rotations, fluctuating schedules would move me down. I knew that I still needed to do some of these parts of the program, but could prepare for them with the action plan. If possible, I would make this a key part of the program for all residents because it made it so that I was communicating much more than just a color when I told my advisor where I was on the stoplight. Having an easier way for residents to reach out for help might be able to reduce the amount of last-minute sick calls or medical leaves that happen, and therefore could reduce the overall workload for the residency and faculty. And actually, we found exactly that. So when people could say, hey, I'm going to stop sharing because I do have resources for when you guys get the PowerPoint of things about well-being and other things. But we found exactly that. Once we started using this tool, our residents were able to like prevent the last minute cancellation of clinic because they were overwhelmed, or they could say, hey, I'm realizing I'm like totally in the hole with my notes and my inbox, and that this is getting me in the yellow zone. Can I have an extra half admin? Like they were able to ask more proactively for what they needed to keep themselves balanced. And overall, it has made our residency program run much more smoothly. And residents have actually, we did a survey like for postgrads, and some of our residents have written back that they are still using this as a way of kind of checking in for themselves going forward. Again, this is one tool. This is not like the end all be all. But this is how we implemented it in our program. And I'm hoping that maybe this was useful for you all. Does anyone have questions, thoughts, concerns?
Thank you very much. I don't see any questions in the room, but thanks so much for talking to us about this.
Yeah, you're welcome. The last thing I will share is that some of our residents told us that they felt more comfortable sharing with their peers about this rather than like sharing with an advisor or with program leadership. So if you have someone that you're particularly close with within the program that you feel comfortable saying, hey, what did you think about that workshop? And, you know, I thought it was ridiculous, or I really don't want to do this, or I never want to think about it again, or I really like this. Would you mind if I share, you know, what came up for me or kind of what I want to work on? And would you be willing to be an accountability partner? I think when we either are making change or are focusing some inward reflection, it can also be helpful to outwardly connect with somebody around it. So just something to consider for all of you. Okay.
Thank you, Dr. Meehan. Thank you guys so much for joining us.
Thank you.
Thank you.